Hello everyone, my name is Dr. G. Ravichandran and a senior practicing dermatologist from Chennai. I consult in the Apollo group of hospitals and the clinic in Bazanagar called Pain Clinic. Today we will be discussing on an important refractory condition called pruritus. Its impact on the patient's well-being. Pruritus, otherwise called itchiness, is a symptom where anyone can get the itchy feeling. They start scratching. Pruritus is defined as unexplained itch without any manifest skin lesions. Whereas there are other conditions which can result in skin conditions which are also prone for itching. Itch is the most important symptom in every disease affecting the skin, and it is mediated by a receptor called histamine release, the itch receptors. Though itch is the most pleasurable sensation to scratch, we know that when a mosquito bites, you like to scratch. But the pruritus, which I am going to discuss today, is the most difficult condition, and we have to understand this causation, the investigations, what we do, what could be the cause, how do you manage these affected individuals with unexplained pruritus. The pruritus is commonly seen across any age group, and particularly in patients, particularly elders, senior citizens. They have a severe itchy condition. They start scratching, but there are no other reasons in these individuals. So we have common causes called the dry skin, otherwise called xerosis is the common factor. And the xerosis and dry skin can be due to underlying comorbid conditions like hypothyroidism, diabetes mellitus, hepatic disorders, and renal disorders. And the commonest, my professor always remember, any generalized itching, there are no manifest skin lesions, look for anemia. Low hemoglobin is the commonest condition which is affecting the women, so they have a tendency to scratch, called the pruritus. There are conditions, of course, pruritus also can be related to any infections, parasitic infestation, drug allergy, urticaria, then we have the drug reactions or insect stings. There are umpteen number of many causes for the pruritus, and commonest one, we should never forget to rule out any underlying kind of a liver disease, chronic renal disease, otherwise called even in hematopoietic malignancy in particularly elderly individuals. So how do you manage this condition? We try to screen these individuals for obvious causes. If not seen, we investigate these patients. Simple test is a complete hemogram, which will definitely throw a lot of light whether it's related to any kind of anemia or any kind of hematological disorders. Then we look at the other causes, like I told you, systemic causes for pruritus. So we more or less come to some diagnosis. Sometimes psychogenic pruritus, generalized dry skin, or stress-related skin conditions can occur. Hives, sometimes patients do get hives. They start scratching in the middle of the night. So the hives are totally different entity. They also result in kind of a pruritus. So coming to the diagnosis, as I told you, there are not much of skin investigations to be needed, but we need to start the treatment. How do you manage these patients? So try to elicit the good history, try to find out the cause for this pruritus, and the list of conditions which I told you must be ruled out, and then we initiate topical, oral, systemic treatment. What could be the topical? If there's a dry skin, xerosis, they have to use an emollients. Emollients are best used to get the barrier function and hydrate the skin. Very, very important. And number two, then we give topical lotions, calamine, as well as we have the promoxin available with other agents, topical steroids, topical calcineurin inhibitors. Sometimes we do give, always we have to adhere to the sheet anchor of antihistamines. Antihistamines play a major role. We call this as anti-allergic drugs, and we have a first generation and the second generation antihistamines are very available. Some antihistamines are sedative. Sometimes we have to avoid the sedative antihistamine, particularly in the school-going children as well as the elderly individuals. So otherwise, second generation antihistamines play a sheet anchor in the management of generalized pruritus, and of course we have to identify the underlying cause and treat. Never self-medicate, teach to a nearby dermatologist so that the we give the best relief to these patients and we improve the quality of life from our dermatologist point of view. Please visit a nearby dermatologist for further discussion and then try to get rid of your condition called pruritus. Thank you.
For more such videos, visit or log into dermavidya.com.